Well, I'm going to take the liberty of beginning so that we don't get too far behind. And so I will welcome everybody who is here back to the afternoon session. The first session of the afternoon will be moderated by Ignatius Bao. Mr. Bao is an independent healthcare policy consultant who focuses on issues of patient-centeredness and health equity, some of the things that actually we really want to know more about. You can read more about him in the handout, and it'll give you more of his background in addition. Mr. Bao.
Thank you. So I'm just going to play the role of the moderator and introduce the speakers for this panel, and then moderate the questions and answers afterwards. I think the way we intended to design the panel and invite the speakers to actually really address, as we shift into the afternoon, some of the solutions to the issues that were raised in the morning, and particularly at the policy and systems level in both the national or federal space, as well as state and local systems and policies. And so our first speaker will be, I'll introduce all the speakers at once, and then they'll go in order. Our first speaker will be Jessica Briefer-French, who is a senior research scientist at the National Committee for Quality Assurance. As many of you know, the National Committee for Quality Assurance has a number of quality standards and measures, and she'll talk a little bit about how these issues of health literacy, language access, and cultural competency have been incorporated into those national quality standards and measures. Our second panelist is Sarah DeGia, and Ms. DeGia is the Executive Director of the California Pan-Ethnic Health Network, which is a community-based health advocacy organization here in California. And Ms. DeGia will talk about some of the legislative proposals as well as administrative advocacy that her organization has done at the state level to advance these issues of health literacy, cultural competency, and language access. Our third panelist is Dr. Marshall Chin, who is a professor of healthcare ethics in the Department of Medicine at the University of Chicago. Dr. Chin is also the director of a Robert Wood Johnson Foundation funded program office that focuses on finding answers to healthcare disparities. And he'll talk a little bit about his experience directing that program office and the kinds of interventions that a variety of different organizations were successful in implementing and incorporating these concepts of health literacy, language access, and cultural competency. And finally, last but not least, is Dr. Stacy Rosen, who is a member of the Roundtable and is the vice president of the Katz Institute for Women's Health, has tremendous expertise and experience in both women's health and cardiovascular health. And she'll talk a little bit about the ways that her system, a large health system in the East Coast, has been incorporating these concepts, and how it also is been integrated into some state level health transformation efforts as well. So Jessica Briefer-French will start us off.